Okay, good morning. I would like to thank all the organizers of this Congress and express my gratitude to Alicia Williams. I am Dr. Fabio Fantozzi, and I took my residency in plastic surgery in Italy, in Brazil with the professor Ivo Pitangui, and now I work in Rome, in Italy. For my presentation, I would like to explain my approach to brachial lifting. The concept of the beauty change of the time, but the harm has always played an important role, especially in considerations of female beauty. The study of anthropometry defined the beauty of the harm from a geometric perspective. Anthropometry, therefore, is the plastic surgery in the planning of the reshaping of the arm. The arm is an important tool located close to the head and with the ability to be rotated in many axes. For this reason, the measurements of the arm is more difficult, as its position is always changed in its measurements. The study of anthropometry is widespread in artistic field, and I have chosen the work of sculptor Carlo Rocher as the basis for my own use of anthropometry during plastic surgery. Proportion of ideal arm measurement from the center of the torso divided into 4 sections. The total of these 4 sections must be equal to the length of the leg. The leg is measured independently of the torso. When the limbs present this characteristic, we can say they have the ideal proportions. How much the excess skin is important to remove in this surgery? The quantity of the excess skin removed from the arm must be geometrically proportional to the forearm to avoid changing the anthropometry of the upper limb. The shape should be within the truncated cone shown. This projected from the armpit and deltoid to the wrist and define the ideal proportion of each part of the limb. In this example, the upper arm is not in proportion with the shoulder, forearm, and torso. The result of the surgery should restore the correct proportion of the upper arm. The truncated cone shows where the works need to be done. After surgery, the upper arm is now inside the truncated cone. It is in proportion with the rest of the torso, the shoulder and the forearm. Arm morphology. 2 types of flaccidity without excess fat due to excess fat. This is flaccidity without excess fat. Loose skin is a good candidate for brachial lifting. Flaccidity due to excess fat, in excess of fat can also be rectified using brachial lifting and standard liposuction technique. Typical candidate for surgery. A patient who has lost muscle tone over the time, possibly due to the age. In these cases, the patient is normally between 50 and 70 years old. And the patient that make a bariatric surgery and has an age between 20 and 60 years old. Routine pre-op examination. Normally, I used to use ultrasound scan of the arm, blood test, cardiovascular evaluation. Anesthetic procedure. I prefer very light sedation with local anesthesia. Now, and so the technique. The incision is formed of 2 curves, one long and one short. The shorter curve is closest to the torso. And so we make the incision between the anterior you have something only to the direction.
A pointer.
Ok, Okay. The incision is inside the anterior axillary line and the posterior, and so stay in very. The scar is located in a part of the arm is not frequently visible. We have two flaps. As shown on the screen, we create two flaps, A and B. Flap A has the opposite traction to flap B. This is the direction of the traction of a flap A, is a downward vertical traction. And this is the direction of the traction of a flap B, as in oppositive vertical traction. And so we have flap A that go down and flap B that go up. Now I show the last force vector. In this case is horizontal traction. Is very important for reducing the skin flaccidity present in the axilla, and so in this area. This is the preparation of subdermic flap and would minimize adipose tissue trauma. Traction of a flap A is a downward and sideward direction. Temporary suturing of flap A, repeating the process for flap B, remove the excess of skin of flap B, intradermic suturing using for the skin monocryl 5.0. We can see the healing stage of the scar immediately after the surgery and after 8 weeks and after 60 weeks. We can see the quality of the scar. The balanced triple vector tension created with the technique described in the two curves reduce the scar retraction. Normally in this type of the surgery, we have only vertical or horizontal scar, but this scar is depressed and the quality is really is not good. Statistical data. Number of patient per rated 30, average of patient 53, youngest patient 30, oldest patient 78, female patient 23, male patient 7. Additional procedure liposuction in 10 patients performed before the brachial lifting. Post-op complication, long-term complication, permanent none. Temporary paresthesia upper limbs in 6 patients, resolving naturally with 3 weeks. Temporary loss of feeling in 3 patients, resolving naturally in 1 week. Temporary swelling of hands in 3 patients, resolving in 8 hours. Follow-up for 60 weeks in 23 patients. Surgical scar revision in 3 persons, and corticoid therapy in 13 patients. And so we look the result before and after. After 60 weeks, we can see the conic. We expect the anatomy of the anthropometry of the arm. Before, after 60 weeks, the truncated cone overlaid. Before and after 60 weeks. Before, after 60 weeks. This is a male patient. We can see before the surgery. After 55 weeks, we can see like the quality before the skin and after the surgery. And the truncated cone overlaid. Before, after 60 weeks, the truncated cone overlaid. Before and after 60 weeks. Truncated cone overlaid. Conclusion. In this technique, the key is the balance of the triple vector tension created which greatly reduces scar retraction complications. The incision of this surgical technique is composed of two asymmetric curves. The curve closest to axilla is usually 3 times the length of the other. Using the anthropometric study of the arm, the conical fluting discussed early result in harmonious definition of the final arm contour. This presentation for the basis for my article published in the European Journal of Plastic Surgery the last year. Thank you very much for your attention.
We want to congratulate Dr. Fabio. Terrific work, very good work.
We are on time, so if you have some questions to the speakers, please.
Do you want to see the scar?
No, I'm asking if you use the
Add the suture. Because only for intradermic suture, I use monopill, but it's very 5.0, but only for intradermic. And I prepare under the skin with a nylon 4.0. That is only for intradermic suture. I like very, very, very thin, suture. Not big, yes. Because for the result, it's really important to prepare the scar. For the scar, it's important to use a very, very thin suture, the stitch, because the result could be not really good if you use a big suture.
Yes.
Well, arm is I understand your technique is fantastic with the flaps, and tension is lower. You have very nice scars. But I see another problem. The arm has fat. Sometimes
yes.
Many
but
fat
always
yes. What do you do with the fat?
No, but before always, and when I have fat, I make liposuction, and the liposuction. And I prepare before to do the brachial lifting, because brachial lifting is indicated for 2 types of persons. There are persons that have flaccidity, only flaccidity. In this case, I do only brachial lifting. Or I have fat. In this case that we are talking, I do very strong liposuction before, and after I remove very much more, quantity of skin, and but that's I do it short because I need, to remove the fat tissue. That because it's important that reduce the volume of the arm. That is the first point that the patient asks for the surgery.
Don't do it together. The 2 procedures you don't do together.
No, I do together.
First
liposuction, and after brachial lifting.
Okay.
Yes.
Okay. Any problem with necrosis of the?
No, because in the reality, when I remove the skin, I stay very careful that I don't arrive in the excess, of tension.
Okay.
And because I have, in the reality, I have 2 curves. And I remove from flap A, I remove the skin from the flap B, and I remove the skin from the other tension, horizontal traction. And so in the reality, I remove skin a different part of the arm, and in the hand, the result is not a strong tension, because I have 3 parts that remove.
Okay.
But I have no plans. The quality is really, and this surgery is really quick. It's 1 hour, 1 hour and 20 minutes. I can do it.